Welcome to the 7 o'clock talk. And tonight we're going to talk about women's issues. And I have to be careful because that's just a landmine waiting to be stepped on. Because you're dealing with a stress migraine. And so let's just talk about the way that we look at women's issues at Integrated Health of Indiana.
Because women are different than men.
Absolutely.
Can't treat them the same.
No, you cannot. And so we start the process for everybody actually the same, though. We have a framework that we work with people on. And as we work with that framework, then we can get to decide, because when I graduated from the IFM, you have all of these tools, but you're not given a place to start. You're not even really given a philosophy with which to think about the patient. You're told, here are a lot of the common root causes. These are how you measure them. Then how do you want to go attack them? Or how do you want to go address them with the patient? And that's where it's fun. I mean, that's where it really gets fun, because if you break people down into stress, GI, and detox, and then in those subsets, you have infections, and you have parasites, and you have neurotransmitters, and you have hormones, you have leaky gut, you have all of these different things, food sensitivities. You now have a framework with which to walk through somebody's problems systematically and over time, because this is not fast. This is not, oh, I have a migraine or a headache and I'm going to take Imitrex, or I'm going to take Tylenol or whatnot, and it just goes away. It doesn't work that way. My analogy for people is the body always finds a workaround. So if you haven't addressed the lifestyle issues that cause 90% of chronic diseases. Now, functional medicine deals with chronic diseases real well, and it deals with optimal performance real well. It does not deal with death and dying and critically ill well at all. You know, we don't have life-saving therapies and drugs that an MD does or an emergency room does. So we don't have those types of things. When we do the testing, if we see blood in your stool, we're going to tell you to go see somebody else. If we see your hormones are tanked, we're going to tell you to go see somebody else to work with while we do all of these other things as well. Because it's very important to address all of these things so that you function the best, you function optimally. And what are the big three things that we see in women the most? Give me the big three disorders. PCOS.
I was going to say symptoms or issues.
Labels. So let's do the big three labels. PCOS, thyroid. I would either say acid reflux.
GERD.
I'm
trying to think about it. But symptom-wise, it's always, I'm tired. I can't lose weight. I feel like garbage.
I go to sleep. I wake up tired.
I can't sleep.
I have diarrhea all the time. I'm constipated all the time.
I wanted to say something, because when you were talking, I listen to all kinds of other things, because I'm always trying to learn, and I don't necessarily think that we know everything, but I'm always trying to learn from everybody else. So I follow all kinds of holistic and integrative medicine people. But I had this one guy today that I was quite interested in. He was a medic. So he's like, when I went to, before I went to college, I was on a team in the Air Forces somewhere. And his role was, he was the medic. And he was taught to use everything available to him except drugs, however it was to take care of the person. And so then he's like, I got out and I got really good at that. I got really good at utilizing everything around me and thinking outside of the box. And then I went to medical school and they taught me one way to treat a person, and it was always with medications. He's like, and it made him very, very unhappy because he said there was only one way they were taught to treat a person. And it was totally opposite of what he had learned. And so he found himself sick and tired and unable to help himself. And so he found himself going in his little journey to other physicians trying to help himself. And over time, he realized that this wasn't working. So he started researching and doing his own thing. So now he's a functional medicine doctor. And not only did he treat his own, I think he had a rheumatoid issue. And so his thing was, I learned about the gut and I learned about detox. And within 6 weeks, he was doing better. And it wasn't about strict diets or, having no fun. It was about learning how he worked and learning to use the tools outside of medicine to allow the body to heal itself. So he helped himself, he helped his wife, and it was such a passion for him, which kind of is kind of the way we are. But he's like, he rarely uses medicine. Medicine is always the last resort. And as I was listening to him, we were kind of the same. And I thought it was quite interesting that, even a medic in the armed forces, they were taught to utilize everything except medication because most of the time they didn't have it. And then we go to medical school where we're supposed to be taught to help the body, cure the body. And the only thing that we do is utilize medicine.
So how does that pertain to women's issues?
Well, we don't use medicine, one, and your body will come back online and heal itself within reason if you give it the things that it needs. So you have to sleep to create your hormones, and your hormones are not just your sex hormones, but it's your thyroid. Your thyroid drives your cholesterol. Your blood pressure is tied to those things. You have to eat well because you have to have the nutrition in order for the body. But it all comes down to, is your cell healthy? And if your cell is not healthy, you can't really fix anything. That is a barrier.
And
like
that's,
that is where what we call it's being clogged up.
yeah. And so in cell health, we measure that through phase angle. And so where she's ultimately going with this is detoxification. And how does that help women's issues? Well, a couple things. I was actually looking through the genetics of a teenage female, and her diet is not good. And so I actually did her genetics. So I pulled her genetics up, and I was showing the mother the BRCA gene. So this person is actually homozygous for the BRCA genetics. And what that means is very susceptible to breast cancer, especially if they don't eat lots of fiber. That's why one of the reasons why nutrition is so very important. Part of detox is giving your body what it needs to detox. How does the body detox? It binds stuff with fiber
So
get it out.
Yeah. So this leads me back to this person that was talking. So most people don't even understand that you should have 2 bowel movements a day at minimum. They don't necessarily think that having a bowel movement a week is not normal.
Let's take a time out on that. 2 well-formed, non-stressful bowel movements. Look up what is that chart? Bristol stool chart. That will tell you. You want 2 bowel movements in the normal.
And if you're doing that, then most likely you are detoxing appropriately. But and that's generic, but that's a good start. But so like getting back to your cell health, how we talk about thyroid's a huge, probably I would say 75% of our patients have what they say is hypothyroidism or are being treated for it.
Oh God, yeah.
So a lot of times they're only checking the T3, right? T3,
TSH.
TS,
They only check.
TSH.
They do that as the screen, and if TSH is okay, they rarely go in, but they will look at T3 and T4. But if TSH, T3, and T4 are normal, they never look at the antibodies.
But the problem here is you can have the hormones, the TSH, the T3, and the T4 circulating in your blood, which is a blood test. And that's usually how they check it. But if your cell is unhealthy and can't move it through the hormones through the cell membrane, it doesn't matter how much of that you have in your blood, you aren't able to utilize it.
So let's tell them what's necessary for a healthy cell.
Water, fat,
Good fat,
and your nutrients. But you're
and hormones.
Wow. Yeah.
And exercise. If you want truly healthy cells, they require exercise.
But you can't utilize the hormone unless you have the cell being healthy. So it's the root.
It's a circular argument.
It's the cell. Like you have to be able to transport the things in and out, but you also have to have the things to transport in and out. So when you have to have water is so important. Probably when I look at it, the number one thing for a cell is water, to have the right ratio inside and out. And then the ability to transport the things in and out of the cell.
Actually, water with electrolytes. You have to have the magnesium and sodium and calcium to run the channels. So for women, your cells are they're not different than my cells. They're not. But there's a bilipid layer. There's 2 outward facing lipid cells. And then you have to use active pumps typically to bring sodium in, bring glucose in. That's why they call it a GLUT transporter, glucose. You use things to bring it into the cell, but that cell health, that lipid layer has to be healthy. And guess what? If you eat French fries and trans fats, it's not. But if you eat avocados and raw nuts, it's going to be healthier.
Well, yeah, because so just imagine it. You eat a bunch of junk, it gums up the cell, so the cell can't work, so it can't detoxify. It can't move waste in and out of the cell. So you have a detox issue. And for most people, that's huge. And that's why you're tired.
Uh-huh.
That's why you have brain fog. That's why you have weight inability to lose weight, insulin resistance. And that's why when they finally come online, they don't change anything and they just start dropping weight, because then you're able to move things and process it and get it out.
And I'm laughing because, we talk about PCOS being one of the female issues. And I don't know how many women have come into us wanting to get pregnant. And
I was going to say, you might want to tell them what that actually means.
Polycystic ovarian syndrome.
So for people that are young and they're growing facial hair.
Lots of acne.
Yeah, acne, oily, thin hair, belly fat, tired, sluggish, infertility issues.
For most of those women, we'll do a Dutch test that tracks their cycle. and we start to do a cyclic augmentation. We don't do cyclic augmentation right off the bat because we want people to be actually healthy before they conceive, because otherwise you're just perpetuating an issue. But once we have sleep in there and we have a good, well-rounded, wholesome diet. I'm not saying an elimination diet. I'm not saying keto. I'm not saying vegan. I'm not saying vegetarian. I am saying a well-rounded whole diet. The person is healthy enough that if they want to have a beer, they can drink a beer and it doesn't hurt them that bad. Just talking about standard, what we used to take for granted as overall health, because we used to sleep. We didn't used to sit up all night scrolling on our phones or binge watching television. We used to eat with the family. We used to cook. I shouldn't say you, we do. But for the most part, when I talk to my patients, they don't. And we've had inadvertent pregnancies because they didn't think they could get better or could have children, and they had children because we cleaned things up. Their hormones came back online, and lo and behold, they got pregnant. And they're like, I didn't know I could.
Well, and infertility, I think I hear that, I mean, throughout our family, but in our community, that is such a huge thing. And I beg and I plead for these poor women, please don't mortgage your house. It really can be as simple as changing your lifestyle. Sleep, nutrition, exercise. And you don't have to go kill it at the gym. It's really just as simple as starting with 15 minutes of walking a day, over and above what you normally would. But for these women that are suffering from PCOS and they aren't necessarily wanting to conceive, but they have the facial hair and the puffiness and the thinning hair, that is a hormone issue. It's a detox issue. It's a nutrition issue.
It's a stress issue.
It is. And so we're going to the Women's Expo this week in Columbus, Indiana. And so, we have all these symptoms. They talk about brain fog, just totally like space escaped me. Anyway, we're going to talk about all of this. It is really simple. It takes time. If you're suffering from fatigue, PCOS, if you are infertility issues, energy issues, inability to lose weight, you're losing your hair, or you have too much of it, come see us, come talk to us. We can't fix it overnight, but a lot of the things you can start doing for yourself, because your body will heal itself given the things it needs.
It wants to live. Your body wants to live. So let's just take it back to the system and why we do what we do. Why do we test stress? Why do we test the cortisol awakening response?
Stress will kill you.
So
what does that say?
It says, do you want to destroy every chance I have to get a girlfriend? Evidently, Patrick. But anyway, when we look at stress, we look at cortisol awakening response, and that's important because that affects the thyroid and that affects the gut. If you're stressed, your body wants to be in fight or flight. And with fight or flight, what happens to you is your body doesn't care about reproduction. So you got to start to bring that circadian rhythm back, and you got to be getting good sleep, and you got to bring those stress levels down so that your body is relaxed. And then, quite frankly, I mean, when I'm stressed out, I don't feel like having sex. I don't want to, you're too antsy, too jittery, too whatever. So bringing stress down and having cortisol in a productive way, that kind of sets the stage.
So I have a little nugget. So most miscarriages are
Progesterone related?
no, actually no. Everybody always wants to think that if they can't conceive or they have miscarriages, it's because of the female. Oh. And actually, the greater portion of that is a defective sperm. Huh. So most defects in children or pregnancies, I should say, are related to unhealthy sperms.
I would disagree.
No, I just watched a big old thing on it. It's actually, it is actually, now outside
I'll have
of genetics,
to check that out because
actually, and well,
the mitochondria comes from the female.
Wait, I'm not talking about that. I'm talking about when you miscarry, it's usually because of an unhealthy cell, which actually has been led to the sperm, not necessarily the female. I'm not talking about genetics. We're not talking about genetic defects in the cells. It's an unhealthy spermazoa.
Huh. Well, that boils down to stress, poor fats,
alcohol, cigarettes.
Oh, yeah.
Fast food.
Trust me, if you want to have a child
and they were talking
and you're a guy
9 months
and you're eating trans fats and you're drinking and you're smoking,
they always
that's just a bad mix.
Yep, and they were talking about that. And if you were thinking that you want to be parent, for men, they needed to be thinking about it 9 months prior.
Yep. I would agree with that. And so that's the same with women too.
So, I mean, it's just, everybody always just thinks it's the woman that has the baby, carries the baby, blah, blah, blah. But actually, it's that one cell that comes from each of you that is the most important. So it's not just the female.
So, and also, a lot of times miscarriages are because women have a drop in progesterone also. And progesterone is progestation hormone. So those things have to be in a good rhythm and they have to be supported. The next thing that we look at is what's the body burden? So is the body burdened with heavy metals? Is the body burdened with infections? Is the body functioning properly? Meaning, is digestion working the way that it should? Does the body have, we're going down to Houston in October, and we are presenting for Transformation Enzymes at their Houston conference, because we're going to be talking about using enzymes to modulate biofilms. Because if you have, when we do the microbiome test, if you see certain species of bacteria, you know that these cause issues with biofilms. And there are certain species that also break down the small intestinal villi. And so if you're going from mouth to anus, once you get past the mouth and the stomach and the duodenum, once you start to get into the jejunum in that area, that's where you actually absorb your B vitamins. And if those little villi that are actually supposed to take that in are blunted, then we need to be giving you these same enzymes that break down biofilms, essentially, also help with that villi. And so you don't want to have stress, because you don't want to have thyroid issues that cause leaky gut, that cause cortisol to be off, that cause autoimmune issues to start to happen, because then you just started a whole cascade of crap for the person. And that's why it doesn't matter what condition we talk about, there is no one way through. And if that's the one thing that I've learned in the multiple hundreds of thousands of dollars that I've spent on learning all this stuff, that's one of the big things. There is no one way through. There are steps that are basic and foundational and fundamental to all healing. But then everybody's had their own experiences. They've had their own traumas. They have their own stresses. perfect. We are the perfect case study for different stresses. This woman will run her vehicle on vapor. She will run that thing. I will get into the car and immediately break out in a cold sweat. It's so bad that that's the first thing I look at. When I get in the car, the first thing I look at is the gas gauge. Because luckily we live a mile from a gas station. But I have gotten into that car and started a trip, and the lights on, and I'm like, I didn't even notice that. And me, no. If it's getting to a quarter of a tank, I'm ready to stop. I'm ready to fill up. I want to be able to go.
I'll drive it all the way to North Vernon.
Oh God, yeah,
Halfway back.
she will. And I don't do that. On the other hand, bills don't stress me out. Like, we have auto payment, and if I forget to transfer money and the payment doesn't go through, she is on the phone sending me a text, showing me the email, and it's like, okay, yeah, well, we usually have a grace period. Here it is. Go ahead, pay it with this card. I Bills don't bother me, and because I know they'll get paid, I'm not worried about it. She is very on the spot with that. So we're just different that way.
Well, and I think women and men are just different.
Oh,
Completely
yeah.
different.
That's the understatement.
Even the way you treat them is different. So, and we treat them like they're different.
Yeah.
Actually, we treat every single person as unique, as with unique care as they are. So we have a system. Do we
But that's a
follow
framework.
the system every single time? Absolutely not.
More often than not.
We
now.
will do. We are going to follow our system as long as it is best for the patient.
Yeah.
But every single person's care is different, and we don't.
That makes it fun.
And our big thing is your doctor listening to you, or does he or she hear you? Because I guess you can listen to somebody and actually not hear anything that they just said. So I've been to the MDs, and I love MDs. I'm not saying there's a place for everybody. But if your doctor is not hearing you and then doing something about it, then find a different way. We will sit down with you, we will listen, and we will make sure we hear you. And then we will have you tell us what your goals are, and then we're going to figure out how to get you there.
And that, it for PCOS, for thyroid, and we are oversimplifying this a lot. I mean, it's just for the sake of YouTube and Instagram and all that stuff. Everybody is an individual, and we have to have time to get to know you. Our testing is what allows us to clear away a lot of noise and start working with someone. And then we start to make the foundational changes. And that's the big thing. We make foundational changes. And once people have those, and just to be honest, it takes people probably 6 months to fall off the wagon, get back on the wagon, course correct, figure out what their body really is telling them. And usually within that first 6 months, we see the scores, we see pregnancies happen. We see people feeling better. We see people losing weight. We see people start to exercise. That's what we start to see. Then, if the patient hasn't achieved their goals, then we start to look very specifically at organ systems, essentially. Okay, the thyroid didn't clear up. All right, well, let's do a really deep dive on this thyroid. Let's get all the antibodies. Let's break down the iodine. Let's break down the T3 and the T4. Let's see where this is broken. And you can't get to that stage Like a lot of people say, oh, I just want to do detox. Okay, go ahead. Do your detox. And they get sicker than a dog. Oh my God, I can't do a detox. I get sick.
Actually, and that is so dangerous.
Yeah.
So I listen to a lot on detox. I have detox issues, so I'm quite fascinated by it. That actually can send you to an emergency room.
Yeah.
Depending on what you're utilizing and how quickly you're doing it. Because if you don't have those
binders,
yes, but like the pathways open. So we talk about being clogged up. If you don't have the ability to get it out, you'll pull it out of the tissues that are closest and nearest and easy to pull, and then it's circulating in the blood again.
Recirculates.
And if you can't get it out, then you are you're basically poisoning your own system.
Yep. And so that's also why we go the way that we go, because we don't want people who are going. Right now, we have 6 active patients going through detox. And it has taken them, because of how screwed up they were, it has taken them a year to get to this point. But we had to have the cell health come up in between what's normal and healthy, so that we know that the cell, because when you start to detox, the cells take another hit. And there's just a lot to this. That's the art.
Well, and this, so we talked about, does your doctor hear you? So we spend a lot of time with our patients teaching them to hear themselves.
Yeah.
Because
oh God, yeah.
We can see what the problem is sometimes, and we will share it. But sometimes we don't want to hear what the problem actually is, because we don't want to give something up that we enjoy. And so that's where you fall off the horse, because they have to learn to, one, trust us.
And that's normal.
And 2, trust themselves.
Yep.
Because your body will tell you what's wrong if you're listening. So if every time you put something in your mouth, you get sick or blowed up or just feel terrible, even though it's supposed to be healthy, you may not want to keep doing that. And so we will actually dive down so deep that we will have you track everything you put in your mouth. And you know what? It's okay, because we will do it time after time after time
until you put it together.
Until the patient pieces that puzzle together.
Oh, non-nutritive sweeteners suck. I'm just going to put it out there. I know they don't cause calories, but I don't know how many people that we have. Sorry, another anecdote. We have a female patient who never put together that sucralose was something that she was sensitive to. And this person needed to gain weight. But one of the medications that she was on had artificial sweeteners in it. And it caused, was it diarrhea?
Oh, yeah. Yeah.
Yeah. And they had never, ever put that together. And it probably took us, we had a hunch in about 3 weeks of looking at diet logs. We had a hunch. But then we had to work with their doctor. And that's the other thing. We're not opposed to working with your doctors. Medical doctors are a invaluable resource.
Yes, they are.
They have worked their butts off to get where they're at, and they will save you. I'm not taking that away from them. The system that they work in limits them.
Yeah, but we've also learned from experience, when we know nutrition is on point and we've built a relationship with the patient and we trust that what they are saying is true. When we can't figure out what the problem is, we always go to their medicines.
Yep.
And then I will sit there and for however long I need to pull up the sheets to figure out what's in it and how does it work.
And I go through a drug interaction checker that tells us all of the shortcomings. I list them all on there, and it's freaking scary. We have one lady who actually, She broke the internet. I didn't matter how I put in all the drugs that she was on. And let me tell you, if you're on 13 different drugs, it's my opinion that someone is being lazy. Unless you are an absolute train wreck. That many drugs to exist seems implausible to me. Now I'm 53 and I'm not on any drugs, but if you come along with me and eat the way that I eat and do what I do, you'll either A, get off of your drugs, or we will find the problem and we will start to eliminate a lot of the drugs that you're on.
Well, and most of the time,
we won't. Your doctor will.
Your MD, most of the MDs that we've worked with have been very happy to work with us, and they have listened to us and then worked with the patient, because we create a rapport with the patient, and the patients usually have a good rapport with their primary care. So I guess because we're running out of time.
Yeah.
Women's health.
Yeah.
Getting back to women's health, like everything that you do matters. Stress will kill you. Learn to mitigate it. Walk, meditate, whatever it is that you do to calm yourself. Cell health is at the root of most everything. Don't
think that you're too old either, because we got 80-year-olds coming back.
Don't settle for this is just the way it is, or for a physician that just gives you another medication.
You're just getting that age.
Yeah. I lost my train of thought.
Well, I know
just don't accept it. Find a physician that listens. And not only listens to you, but hears what you're saying and wants to help you get to the root of the problem. And you know what? I have a fabulous physician that I've been on a journey with for 2 years, but she didn't hear me the first half a dozen times I went in. And I don't want to be medicated for symptoms, but you don't have to be unless you have a life-threatening illness. There's usually time to help yourself. So find a physician, come see us. If you're having infertility issues, PCOS, you have thyroid issue, you have GERD, your sexual health isn't on point. It does not matter if you're 18 or 82, you should be living your best life. So we usually can help, and we usually can get you to feel better rather quickly, usually just within the first month, with adding supplements to support your hormones, because I don't know that I've seen one person walk through our door that their hormones are on point.
Oh, God, no.
And that doesn't matter how young or old they were.
Well, we kind of rambled on, but I would say that all of that's very important for women's health, because just think about this. We like to think that we are above nature. We like to think that we're better than nature. We like to think that we aren't an animal, but we are. And so it all matters. We may be smarter than the animals. We may have been given dominion over the animals, but ultimately we're still an animal. We still respond to the sun. We still respond to nature. And so it does all matter. What you think matters.
Well, and remember that if you're female, you're not male, and you shouldn't be treated like you are a male.
Yep.
And most of our studies and medications are based on 18-year-old males.
Or it's the standard male, which is the 5'8", 150-pound male. I'm 6'1", I'm 250 pounds. Doesn't work for me. All right. Well, thank you. If you've suffered through this long, hey, if
Call
you,
us. We can help you.
yeah, if you have a question or if you just, you know, we'll do a 20-minute. If you've stuck with us for 40 minutes now, granting, hit us up. We'll do a 20-minute complimentary consultation. We'll talk to you. If you want to send us blood work, I'll look at it and tell you what I see. We're just happy to help because I was asked this the other day. If I won the lottery and was set for life, what would I do? And I was like, I wouldn't really change much. I would probably quit adjusting and bring somebody in to do the adjusting. And I would still continue to do functional medicine because I love helping people. And I didn't ask you that question, but I would assume you
Well,
would
I
be
was just
very
sitting here
similar.
thinking about the same thing. If I didn't have any bills, because I didn't have to worry about the money, I probably would do exactly what we do. We just would do it for free. Honestly, if we had, because we actually really enjoy our patients.
Yeah.
And actually, I mean, I get teary eyed about a lot of our patients because we just love them. So we're there for the good and the bad. We're there to support. And there's nothing like seeing somebody come in hopeless and in need of somebody to listen. And they're at their bottom and afraid they're dying. And to watch them every month grow stronger, confident, sometimes gain weight. And we cheer them on for pounds, or whether you're gaining it or losing it, we are invested in each person and we love to see them thrive and then graduate.
Let's just do one quick aside here, very quick. I say we don't save people's lives. We don't save people's lives in an acute care setting. We have seen people who were definitely dying and they have put the work in. All we do, a doctor is a teacher, a nurse is a teacher. They put the work in and they are thriving. And we've seen people go from 90 some odd pounds to the 110s and 120s.
We've had our 70 pounds was our lowest. So, I mean, everybody always thinks, oh, everybody wants to lose weight, but there's some people that need to gain weight.
That's not me.
And their life is depending on whether they gain. And each pound is a huge loss. So we've had patients that were losing 7+ pounds a month and really had nothing else to lose, to not holding their own, so not losing, but to gaining, and to watch them become the person that they used to be, that we didn't get to see. It's like a flower opening up. They shine, their eyes are bright, their skin gets beautiful, their hair grows back. They just shine from the inside out.
I'm giggling because I can remember legitly looking at one patient in particular at her phase angle and looking at her body fat. And I'd never seen I've never seen a reading on the bioimpedance analysis machine that was like zero.
Well, in this case, so to put that in perspective from the medical side, when somebody has zero body fat, that means they've lost the fat around their vital organs, their kidney fat, which is so important, in the fat that protects their vital organs. And when you have lost that fat, you're in serious trouble.
And it's come back. So we've talked well enough. You can tell that we're passionate about this. This is what we actually really enjoy doing. And so we'd love to help you out if we can. You all have a great night. We have to go pick up a little girl.